Hi everyone, my name is Camellia, psychiatric mental health nurse practitioner, also known as a PMHNP, and I am a nursing and mental health enthusiast. And I'm getting on today briefly to actually share just something that I feel led to share with you guys, but most importantly, something that holds a lot of weight in terms of the significance, the impact, the consequences, but something that's not talked about as often. And so this is another one of those less talked about topics. And as you guys know, I've really tried to be very transparent with you guys on this channel. And really, the goal is to, lessen the load for someone else coming along the way, just by providing some insight, some of the know-how, and also some of the things that I've personally experienced that could be something that someone else may experience and could possibly avoid. And so that's what this channel is about. And so today I just want to share a little bit about compassion fatigue. You guys have heard me say in previous videos that this is not a field that you just go in because of money or because of external things. Yes, those are benefits of it. However, it is a field that you go into with a true sense of purpose and caring and compassion. And most of us are in this field for that reason. But the downside of being in a field where you're giving out so much, whether it's nursing or even more in a psychiatric nurse practitioner role where you're, taking on a lot of what people, may be telling you, and you're experiencing to some degree from a secondary standpoint, some of the traumas that, people come to you for, talk to you about. And so the reality of that is that there can be a negative cost to caring. Compassion fatigue is exactly that. It's also known as secondary trauma. And it can happen in a place where you are repeatedly exposed to things that are not positive, things that are traumatic, and things that can affect you personally and professionally. So I certainly want to touch on this topic because there is a high risk for that in psychiatry. And it's not necessarily the same thing as burnout, but it can affect you to the point of, you losing your sense of purpose and, kind of throwing in the towel to say that you don't want to do it anymore. And so I think the biggest part about this is being prepared and having an awareness about sort of the fact that this could happen, but secondly, how are you going to manage it if you start to show signs of this, or if you get to a point such as this in your career. I can personally say that I've been very close to this in the past, and it's not fun because from a heart level and from a professional standpoint, you still want to be able to give to people, but there is the reality in that it has a negative cost where sometimes you don't feel like you can continue doing that, at least in the way that you had been doing. So compassion fatigue is just that. Some of the symptoms that, you may experience are exhaustion, irritability, anxiety. A huge one is also emotional disconnection, and you may even find that you lack a sense of purpose when you are experiencing compassion fatigue. So those are very important things to be, one, mindful of. But secondly, as I mentioned, the most important part of this is being prepared. And by preparation, I mean, one, knowing and having an awareness that this can exist or can happen. But secondly, what are you going to have in your toolbox to continue to allow you to do the work that you desire to do, that you may have a purpose in doing, and do it well so that you're not affected personally, professionally, and then so that you're able to continue to give what's necessary to your patients. So in that preparation in your toolbox, I always encourage others to have the things that you find fulfilling for you, that give you something back, that allows you to debrief, that allows you time away. Anything like that are the things that I would say maybe have at least 3 to 5 of those things in your pocket at all times. And usually 2 to 3 of them I would say will be important to do on a regular basis. So for me, I have 2 things that I have in my toolbox all the time, and one is exercise. I exercise usually about 5 days a week in some form of exercise, whether it's walking, whether it's getting on a bike, whether it's going to a gym class. I am doing that regularly, which I think has helped me tremendously, particularly during my busier days, busier seasons of working as a PMHNP, because it's allowed me to offset some things and just be able to have that boundary. The second thing I would say that could be important is setting boundaries around, things that may tug at you more. You may have to set boundaries with patients. You may have to set boundaries with things outside of your job, just so that you're able to continue doing the work that you want to do. And the big thing about compassion fatigue as well, guys, is that it widens the gap between what you're giving and the care that you can give to yourself. So basically, the more you give, the less you feel that you can give to yourself, or sometimes it's even about the time and the effort that you feel that you can give to yourself. So with that gap being wider, of course, you are losing out on what you're able to kind of fill your cup back up with. And so that's a recipe for compassion fatigue and even burnout. So other examples may be scheduling your PTO, every so often. I used to work with someone who would strategically schedule her time off every, month or so, every couple of months, so that she would always have something to look forward to, and a time that she could plan to debrief and just be able to kind of reset. So those are just some examples, but certainly the other thing for me is my spiritual care. I really, that's really important to me. And so that's also something that I've found very beneficial for me to be able to kind of reset and take time away from all the things that you're exposed to all the time as a PMHNP. And ultimately, our goal, we want to still be able to give to people. We want to still be able to do our best, and we want to feel like we have some purpose in doing that. So find your thing is what I usually say. And I say this, it's important to start this as a student. If you're a PMHNP student right now, if you're a nursing student right now, these are the times that you want to start focusing on, what are your things that you'll have available for you in times where you need to, one, just maintain consistency, but secondly, if you find yourself in a situation where you do have or are experiencing burnout or compassion fatigue. Sometimes those symptoms of both are kind of overlapping, and so it's important to understand what they are and what the symptoms are. But certainly, you guys, I would encourage you just to find a few things that you can commit to consistently, and then having a couple more things that you can maybe, do as you are doing this work, so that you can continue to serve your patients in the best way. Again, this is a less talked about topic, but it's one that, from real-time experience, I have found, it's important to acknowledge, because the consequences, you lacking your own self-care and your own mental and physical health may be at risk. And then also, of course, the patients, you're not able to give as much to your patients. So certainly the consequences are high, and there's a high stake with not committing to these things. So again, find your things. You guys drop comments below and tell me, what do you guys do to continue to keep yourself going in this work? And maybe what do you plan to do to commit to that so that you don't experience compassion fatigue? I'd love to know you guys' thoughts, and I look forward to seeing you guys in the next video.